Good afternoon, everybody. Today I want to begin with the good news, the approval of the Oxford-AstraZeneca vaccine, which is a fantastic achievement for British science and which will allow us to vaccinate more people and also vaccinate them more quickly. And there's one important development that's helping us to accelerate our vaccination programme across the whole of the UK. We've had new advice from the Joint Committee on Vaccination and Immunisation that the first dose can protect people against the worst effects of this virus because the benefits kick in after 2 or 3 weeks. And so from now on, we will give a first dose to as many vulnerable people as possible, with the second dose to follow 12 weeks later. And what that means is we can vaccinate and protect many more people in the coming weeks. I know that everyone watching this will want to know when you can get your vaccine. And all I want to say is that we are working as hard and as fast as we can to get the supplies to you. And as soon as we have the supplies, we'll be getting them into people's arms. To summarise where we are, we have to face the fact that we've got two big things happening at once in our fight against COVID. One's working for us and one working against us. On the plus side, we've got two valid vaccines and we're racing, as I say, to get them out. On the downside, there is a new strain of the virus which is spreading much faster and surging across the country. And we've seen a 40% increase in cases in England in the last week alone, almost 15% more patients in hospital, more than at the peak of the first wave. And yesterday, sadly, we recorded almost 1,000 deaths across the UK for the first time since April. So at this critical moment, with the prospect of freedom within reach, we've got to redouble our efforts to contain the virus. And that's why the Health Secretary has announced that more areas of England will be moving into Tier 4 from tomorrow. And I say again, no one regrets these measures more bitterly than I do, but we must take firm action now. And that's why we have to think very hard about schools, because today, of course, it remains the case that keeping children in education is a national priority, and it remains the case that schools are safe. But we must face the reality that the sheer pace of the spread of this new variant requires us now to take even tougher action in some areas, and that does affect schools, and let me set out for you what this means. In most of England, primary schools will still reassemble next week as planned for the new term. But in the areas we've just published today on gov.uk, I'm afraid the start of the new term will be delayed until at least January the 18th, when the latest data on those infection rates will be reviewed. And that is because the rate of transmission in these areas is so high, and there's just such pressure on the local NHS that extra action is required to control the spread of the virus. The children of key workers, or those who are considered to be vulnerable, will still go back to primary schools from next week, wherever they live in England. And they are not affected by today's announcement. In secondary schools, all vulnerable children and the children of critical workers will go back next week across England as originally planned. But we will ask exam year pupils in secondary schools to learn remotely during the first week of term and return to the classroom from 11th of January. The remaining secondary school pupils, i.e. non-exam groups, will go back a week later, that is from the 18th of January. But I want to stress that depending on the spread of the disease, it may be necessary to take further action in their cases as well, in, as I say, the worst affected areas. To minimise disruption in schools and to fight the disease, we're massively expanding our testing operation, ensuring that every secondary school pupil is tested as they return and regularly thereafter. I, again, want to thank teachers, pupils, parents who've worked so hard to keep schools safe and keep them open. We're also asking universities to reduce the number of students who return to campus in January, prioritising medical courses and others requiring face-to-face teaching. And in all cases, students should be offered 2 rapid tests when they return. All of these measures are in the end designed to save lives and to protect the NHS. And for that very reason, I must ask you to follow the rules where you live tomorrow night and see in the new year safely at home. That means not meeting up with friends or family indoors unless they're in the same household or support bubble, and avoiding large gatherings of any kind. We are still in the tunnel of this pandemic. The light, however, is not merely visible. Thanks to an extraordinary feat of British engineering, if you like, the tunnel has been shortened, or we're moving faster through it. And that gives me great confidence about the future in the spring. So, for now, let's redouble our efforts. Let's follow the rules, protect our NHS, and together make 2021 a year in which we leave this tunnel behind us. I'm now going to hand over to Jonathan Van Tam to go through the slides.
Thank you, Prime Minister. I'm going to now deliver the data briefing to you. And I would first of all say that always remember, please, that infections happen and then they are reflected in the statistics several days later when people come forwards for testing. They're always out of date by a few days, in other words. On top of that, Christmas is always a difficult time to assemble stable statistics. So please bear both of those points in mind. First slide, please. You can see here 2 pictures of the UK, one based on the 10th of December and one based on the 24th of December. And you can see that the average case rate per 100,000 through testing is 190 per 100,000 on the left, rising to 380 per 100,000 as a UK average by Christmas Eve. The heat maps on the geographic representation, the darkest areas are the hottest areas, and you can see overall there's been a considerable growth across the national footprint in that time, and particularly centred on London, the South East and the home counties, and also South Wales. Next slide, please. This is now being reflected in the number of people going into hospital with COVID-19 across the UK. On the extreme left, you can see Scotland, Northern Ireland and Wales, and then you can see the English regions on the right of the slide. And I really want to draw your eye to the 3 in the bottom right-hand corner, the South East, London and the East of England, where you can see very sharp rises that have really taken off since early December, but particularly so in London in the last few days. With regard to the Midlands, the North West and North East Yorkshire, you can see that things are not running quite as hot as they were in early November. They've come down a bit, but they have not really, they've stabilised at a high rate. They have not dropped low. So that's equally a problem that we face now. Next slide, please. Data from the Office for National Statistics show you here from the surveys the estimated number of people testing positive in England over time, from typically at the start of the autumn 1 in 900 people testing positive, to a point just before Christmas where nationally in England 1 in 70 people were testing positive. And you can see the effect of the national restrictions bringing the curve down in the period between 6th November and 5th December, but then, unfortunately, you can see the sharp takeoff after that. That is all too familiar to all of us now. A little word on this slide on the new variant coronavirus, which has been reported widely in the media. Testing that is compatible with identification of the new variant are the dark blue lines, and the other variants, or the old or the pre-existing variants, if you like, are the brown lines. And what you can see is in that bottom right-hand corner again, where I drew your attention to those very sharp rises in hospital admissions, you can see that in terms of the percentage testing positive for the virus, the percentage testing positive with the new variant is increasing at really a very substantial rate indeed. In the other areas, or most of the other areas, I unfortunately have to say to you that I think to the right-hand side of each chart, with not much more than the eye of faith, you can see those upticks of the new variant beginning to occur. And that obviously is of enormous concern, that the new variant, with its increased transmissibility, is beginning to spread to other areas of the UK. Final slide, please. This slide really geographically summarises where we are in terms of the tier restrictions being announced today. A very large proportion of the UK, 78% of the population, are, as of tomorrow, being placed into Tier 4, with a small minority remaining in Tier 3 and almost nowhere now left in tier 2 and Tier 1. So you can see, unfortunately, it is a pretty grim and depressing picture at the moment. The situation in the UK is precarious in many parts already, particularly the southeast and London, and it is almost certainly true that the NHS has not yet seen the impact of the infections that will have occurred during mixing on Christmas Day. And that, unfortunately, is also rather sobering. So given that picture, I just want to say, look, I know New Year is coming up. I know it's normally a time of great festivity and enjoyment, but you have just got to play your part now in bringing us back from this very dangerous situation that we find ourselves in. I will stop there, Prime Minister, on the epidemiology.
Thanks very much, Jonathan. That's very helpful. Steve, anything you want to add from the perspective of the NHS?
Yes, thank you, Prime Minister. And as the Prime Minister has said, and as JVT has shown you in the slides, high infection rates from COVID are causing significant pressure on the NHS. And that is particularly the case in those parts of the country where the new variant has arisen, and that's led to a rapid rise in infection rates and, again, as JVT has shown you, unfortunately, a high number of hospital admissions, and that's particularly London, the South East and the East of England. So I'd like to start tonight by paying a huge tribute to all our NHS staff throughout the country. They have worked incredibly hard over this year managing patients from this pandemic, and over the festive period they have had to work even harder, particularly, as I've said, in those areas which are seeing those high infection rates with the new variant. They have absolutely gone the extra mile. In fact, they have gone many, many extra miles over the course of the year. And as JVC again has said, it will continue to be tough over the next few weeks. But of course, everybody is able to help the NHS and to assist our incredible staff and play their own parts. As both the Prime Minister and Jonathan have said, we know it's the end of the year. It's a time where people traditionally want to celebrate, but it's absolutely vital that this year everybody continues to follow the guidance by staying at home and not mixing. My colleagues, as I've said, up and down the country, continue to work hard with record numbers of patients with COVID, and of course keeping vital services such as cancer treatment and accident emergency departments open at the same time for people who don't have COVID. So we could all play our part in fighting this terrible virus, stay at home, mark the new year with just nearest and dearest within the rules. This action will reduce infections, relieve pressures on hospitals, and that's how everybody can help to save a life. COVID loves a crowd, so please leave the parties for later in the year. Prime Minister.
Thanks very, very much, Steve. And I'm sure everybody will echo what you have just said about our wonderful NHS care workers, everybody keeping people safe this winter. Let's go to questions from the public and sorry, yes, of course, JBT. Would you say something about the vaccine? Thank you.
Yes. So it's not all bad news from my corner of the room. It's actually also a very good news day with the authorisation of the Oxford AstraZeneca vaccine. And I want to really thank the scientists who've worked night and day for the last year getting this vaccine together, and also thank the doctors and nurses of the National Institute for Health Research, the NIHR, without whom this whole trials programme could not have come together in the way it has. So, you know, we have MHRA conditions for the new vaccine, authorised, very standard conditions, quite what you'd expect for any new vaccine. The JCVI has made an announcement that the vaccine should be pressed into service immediately alongside the Pfizer vaccine. The JCVI's view is that these are two good vaccines with no major distinctions between them. Now, I want to caution everybody, particularly the media, about over-forensic examination of percentage vaccine effectiveness. It's really important to remember that the definition of illness in the Pfizer and the AstraZeneca programs were different, so they were slightly different endpoints, so you can't really compare them. But what really matters to us is not an endpoint that measures illness, but how these vaccines are going to impact on severe disease, on hospitalisations and on deaths. And I'm confident, and I think the JCVI are also very confident, that both of these vaccines will do that. There is already some preliminary data from the AstraZeneca programme. There have been just 2 hospitalisations in the whole of the clinical trials programme in patients who received the vaccine. One hospitalisation occurred 2 days after the vaccine was given, so you can easily work out that the infection occurred before the vaccine was actually administered. And the second one occurred 10 days after the vaccine was given. And again, 10 days is not long enough for a vaccine to work. Optimistically, you'd say 7 to 10 days you might get some effect, but far more typically, it's 14 to 21 days where the effect of a vaccine is going to kick in. So they weren't really vaccine-preventable hospitalisations, and this is very, very encouraging, albeit preliminary data. The other really big thing that JCVI has changed for us in the last 24 hours is this very clear advice to prioritise the first dose to as many people as possible. This makes enormous sense to me as somebody who's public health trained, and I'll try and explain why. Firstly, the JCVI are very confident that there are high levels of protection from both vaccines after the first dose. Secondly, the MHRA has given the operational flexibility around the interval between the doses so that operationally there is room for manoeuvre now. The second dose of both vaccines is integral. It remains important for longer term protection, but the priority is the first dose. And so what does that mean in terms of, how's this strategy been put together? I want to try and help people understand that. And basically, you take what you've got, you work out what you're going to get, you look at the epidemiological situation in front of you, and then the scientists and the modellers from the JCVI put all that together and they say, how do we get the maximum benefit for the most people in the shortest possible time? And that's the approach they've chosen. And this has been strongly endorsed by all 4 Chief Medical Officers of the United Kingdom. Thank you, Prime Minister.
Thanks very much, JVT. Let's go to questions from the public and from the media. First, Cameron in Buckinghamshire.
There are reports the Tier 4 restrictions may be in place until the spring. With so many businesses on their knees, what assurances can you give that this won't be the case and businesses can look to reopen in the new year?
Well, Cameron, thanks very much. You'll have heard about the measures we're sadly having to put into place across many parts of the country, Tier 4 or Tier 3. We want to get those areas out as fast as we can, but the data at the moment simply doesn't allow it. The spread of the new variant simply doesn't give us the scope to do that. I think there will obviously come a point when we've made so much progress with the vaccine and also with tough tiering that there will be different options. We hope that comes as fast as possible. I think that we've heard previously from Chris Whitty and others that April the 5th, Easter, we really are confident that things will be very, very much better. And obviously we'll try and bring that date forward as fast as we can. And that's why the vaccine rollout programme is so important. And what JVT had to say just now about accelerating that rollout programme with using the first dose on as many people as possible is encouraging. But is anything either would like to add to that one? Ivy, thank you very much. Let's go to Jonathan from South London. And this is, Jonathan asks, given the high rates of COVID infections and hospital admissions, why has the government decided not to reopen the Nightingale hospitals? Well, actually, as far as I know, Jonathan, I can tell you, we are going to be making sure that the Nightingale hospitals are available. They are certainly are available, but they're there not to be used immediately as long as the other provision is still there. But Steve, I know you've been working on this very closely. Yes,
thank you, Jonathan. So the Nightingale hospitals have obviously been there over the course of the year. They are our insurance policy. They're as our last resort, and indeed we asked all the Nightingale hospitals a few weeks ago to be ready to take patients if that was required. And indeed, some of them are already doing that in Manchester, taking step-down patients, in Exeter, managing COVID patients, and in other places, managing diagnostics, for instance, and diagnostic services. What we've learnt over the year is that we can use the Nightingales for a variety of purposes, as I've just explained. So we will be keeping those purposes under review. Our first steps, though, in managing the extra demands on the NHS are to expand capacity within existing hospitals. That's the best way to use our staff. And then, if needed, we can also put in place mutual aid between hospitals and healthcare organisations. That's exactly what's happening in London, the South East and East of England as we speak. But as the Prime Minister has said, it's critical that those Nightingale hospitals are there if they are needed.
Thanks, Steve. Let's go to the media. Fergus Walsh, BBC.
Prime Minister, how many people will the NHS immunise every week? Because surely it needs to be in the millions.
Well, thanks very much, Fergus. I think the best answer I can give at the moment is that we will have millions of doses, tens of millions of doses by the end of March. We're working to get the programme going as fast as we can. I don't want to give you specific numbers at the moment, but I can tell you that we are shifting heaven and earth to roll them out as fast as we can. I know that JVT, you've also been asked about this today. Is there anything you want to add on that?
I would add that actually it's probably not the best idea to look at December and how the NHS vaccination programme has started with the Pfizer vaccine and try and overlay that on kind of kitchen table mathematics for how that's going to scale up through January, February and March. There's a real game changer here in terms of the thermostability of the AZ vaccine being handleable at 2 to 8 degrees centigrade all the way through, none of this ultra low temperature, none of the thawing, and a months-long stability at 2 to 8 that is going to give us all sorts of reach and flexibility and scale up. In addition to that, there is an absolute ambition across the whole of the system that the only thing that is going to slow us down is batches of vaccine becoming available. And many of you know already that it's not just about vaccine manufacture, it's about fill and finish, which is a critically short resource across the globe, always has been for vaccines. And then there is individual batch release, which is a safety and quality requirement that absolutely has to take place. But I suspect Steve Powis can give you a bit more detail about how the NHS plans to scale up and how the primary care networks, for example, are raring to come on board.
Yes, thanks, Fergus. So as you know, we have been preparing for many months within the NHS to start this massive vaccination programme, the largest the NHS has ever undertaken. And we started that in December with the Pfizer vaccine rollout, which we knew would be based on limited supplies as we go towards the end of the year. And as you know, as of last Sunday, over 500,000 people had been vaccinated in the first few weeks. We now have the good news that the AstraZeneca vaccine has been approved, and our intention is to start rolling that out through hospital hubs and primary care networks beginning on the 4th of January, in other words, next Monday. And that will lead to a big expansion in the number of people who are vaccinated. And of course, with the other news that we are now permitted to space the second dose, as JVT has implied, as explained, that also means that we can get on and vaccinate more people. So our aim is to get the jab into people's arms as quickly as the manufacturers can supply that vaccine to us. We've been focusing, as you know, on the highest priority groups set by JCVI, so the over 80s, residents in care homes, care home workers, and to avoid wastage, we've also been vaccinating NHS staff. But the increased supply that comes with the AstraZeneca vaccine means that we have written out to healthcare organisations today to instruct them to immediately expand the vaccination programme to all frontline health and social care workers. And as vaccine supplies increase over the next few months, then we will be working to deploy through the next set of priority groups that JCVI have identified.
Brilliant. Thanks, Steve. Let's go. Thanks, Fergus. Let's go to Sam Coates of Sky.
Prime Minister, moments ago you quoted Chris Whitty saying that things will be much better by Easter, possibly April the 5th. Can you just spell it out? What does much better actually mean? People back in offices, seeing friends in gardens or their homes, holidays, or is that all over-optimistic, and should we expect those things to take till the summer or later? And there's a very specific one on schools. If you're a parent of a primary child in a Tier 4 area, but your school is reopening next week, are you still legally obliged to send them if you're worried about infection rates? Professor Van Tam, a practical question. If somebody has the vaccine, can they see their grandchildren, for instance, as soon as the second dose is effective? Or are you still going to enforce the law banning them from travelling, meeting and going into one another's houses, even though for that person it's safe to do so? And finally, Stephen Powis, there are unnerving pictures of ambulances queuing outside hospitals. Could you just characterise how close the NHS is to capacity? Does it feel overstretched in parts? And would you expect specifically the London Nightingale, where things seem to be so bad, to be needed anytime soon?
Yeah, thanks very, very much, Sam. Look, just my message, first of all, on schools, message for all parents except in the school areas which have been specifically identified as being where the epidemic is really surging the most, and where we do, alas, want to postpone primary schools until the 18th. The message is schools are safe. The problem is not the schools. Teachers, school authorities, parents, they made a fantastic effort to make schools safe places. The issue is what happens, the spread from the mixing of households that naturally takes place in schools. That's what we're trying to combat in the very high infection rate areas. So my message would be, unless your area specifically is identified as being amongst those very, very high infection rate areas, send your children, send your family to school in the normal way. Absolutely right to do. And on what's the world going to look like? How do we define success in the spring? Well, if we're right, if the vaccination programme does have the positive effects that we think it can have, and I stress these are ifs, then clearly a lot of the non-pharmaceutical interventions, the closures of hospitality and so forth, all those will recede into the past, and we'll be able to do things very, very differently. That's the hope. Those, I think, Jonathan and I have discussed previously in these occasions. There may be things that we want to carry on in order to protect ourselves, basic disciplines about washing hands and so on. I think JVT mentioned wearing masks. There may be things that we want to continue with to protect ourselves against the virus for a while to come. But the hope is basically that we'll be able to move beyond NPIs if, as I say, the vaccine rollout programme is effective.
Yes, so indeed that there may be things that individuals decide that they've formed habits that they're going to stick with. That's to be seen in the future. Your question to me was rather more about vaccines and behaviour, and if after the second dose of your vaccine it's okay to behave with wild abandon and go off to the bingo halls and whatever you like and so forth. The answer to that is in two parts, but the magic phrase is transmission. I think we can be confident, and we will know quite quickly within a matter of a couple of months the impact of these vaccines on reducing severe illness in the population. And when we know that, we'll be able to say, when you're fully vaccinated, I hope we'll be able to say your chances of severe illness from COVID are very markedly reduced. But right now, we can't say that that is synonymous with you not being able to pass the vaccine, the virus onto others. In other words, we don't know if the vaccines will reduce transmission yet. We definitely will be looking at that. Public Health England have their finger on the pulse on this one through the Siren study in particular, looking at healthcare workers who will be vaccinated and where they're being tested for symptomatic and asymptomatic illness on a regular basis. So we'll get a handle quite soon, I hope, on whether these vaccines reduce transmission. But until then, even if you're vaccinated, I can't assure you that you won't. I can assure you that it's very likely you'll be protected from severe illness, but I can't give you the assurance that you won't still pose a hazard to others through transmitting the virus. We have to just be patient on this point and give it another 2 or 3 months, and then ask me that question again, and I hope I'll give you a much more reassuring answer.
Thanks very much, both. Let's go to Charlotte Ivers. Oh, so sorry, Steve. Yes. Sorry, forgive me.
Just to go to Sam's question on NHS pressures. So I think, as we've all commented, the NHS is under significant pressure this Christmas and New Year period, and that's particularly so, as I've said, in those areas of the country, such as London, as you've noted, where we've seen rapid rises in infections, predominantly because of the new variant of COVID. So the NHS in London, as indeed it does around the country, has tried and tested plans in place to manage surges in activity. And of course, those have been refined further during the year. as we've learned from the first wave of COVID. Those plans are being implemented as we speak. They involve, again, as I've said, firstly, expanding capacity within existing hospitals, ensuring that mutual aid is in place between different healthcare organisations, so patient, staff, sometimes equipment can be moved around. And that's the right thing to do clinically because it's the best way of managing patients. Again, the Nightingale in London is being readied, and if it is required, then we will use it. But the first step is capacity within existing hospitals. But I think it's really important for me to emphasise, as I've said already tonight, that the real key to reducing pressure on the NHS is if everybody complies with the social distancing measures that are in place. It's only by reducing infection rates that a couple of weeks later we will start to see a similar reduction in hospitalisations and the number of people in hospital. So it's really critical that everybody does what actually we've all been doing throughout the year, no matter how tough it is, and stick with those restrictions. Hospitals might seem a distance away if you're well, but actually it's your actions in potentially not transmitting this to somebody else that further down the line can save somebody's life. That's been the case throughout this pandemic, and it's really, really the case this period at the end of the year when we're seeing infection rates at their highest.
Thanks, Steve. Thanks, Sam. Charlotte Ivers, Talk Radio.
Thank you, Prime Minister. You've stressed the need for speed in the rollout of the vaccine. So I've got a bit of a Tiggerish question for you. Could you ever envisage a 24/7 rollout of the vaccine? That's what a lot of our listeners have been asking about, or something similar to that, if not.
Charlotte, well, I mean, I can tell you that people are working around the clock to get this done. But I think I'll hand over to Steve and JVT to talk about the modalities. Steve.
Yeah, so as I've said, we are working in the NHS to roll things out as quickly as possible. We need the supplies to come through from manufacturers, and maybe JVT could say a little bit more around how that process works and the importance of batch releases. These are still unlicensed products. Remember, they have emergency authorization, and so it's important that we do this properly by the book, but we are going as quickly as we possibly can. JVT?
Yeah, thank you, Steve. I mean, vaccine delivery is very much an operational matter for the NHS, but my exhortation to the whole of the system is that we must go as fast as the speed of supplies. In other words, as fast as the batches are landed and are batch released, we should be using them. There shouldn't be any stock held in a room somewhere or a fridge somewhere waiting to go out. It should go out as soon as it can. We have to have that ambition.
But Charlotte, your question is incredibly important, and obviously we're looking at the whole time. The rate limiting factor, as they say at the moment, is supply and not distribution. I think it would be fair to say. Let's go to that will be is being stepped up rapidly as well. Let's go to Mesa Hall of the Express.
Thank you very much, Prime Minister. The extension of restrictions announced today will mean many more businesses have to close their doors. Can we as a country afford to keep borrowing to support those firms and their employees? And should we expect any new measures from the Chancellor, given that so many of us are now effectively back in lockdown in all but name?
Thanks very much, Mesa. And obviously, we deeply regret the necessity to impose these restrictions on ordinary life, on businesses. I know how tough it has been for people for so long, and how tough it is in Tier 4 for hospitality, for retail, and that's why, of course, Rishi Sunak, the Chancellor, extended furlough right the way through to April. And end of April, and also why we have the many varieties of support loans, grants that you'll be familiar with, Mesa. Those will remain there. But the key thing is, as everybody has said this afternoon, to work together to follow the guidance, get the virus down, but also to roll out that vaccine. And I know how. I thought the most interesting slides today were those ones that showed the difference between the new variant and the old variant. And the kind of the sad thing is that you could see how the efforts of the British public were working in getting the old variant under control. And then you could see the way this new variant has just started to spike. The way to beat that is with the vaccine and the rollout. And obviously, as several of your colleagues have rightly said asked this afternoon, we're going as fast as we can to do that. Should we go to Richard Vaughan of the Eye?
Hello there. A quick one for the scientists and then one for you, if possible, PM. How concerned are you about failed inoculations due to the rising infection COVID rates? You said there's a gap between having the jab and developing immunity. Do you expect the efficacy to drop? And given what you said about schools, should we start inoculating school pupils? And just one finally for you, Prime Minister. You said that, the Brexit deal was passed today, and the new vaccine is going to be rolled out. On a personal level, what does this mean to you, given the year that you've had?
So I think why don't we do the questions about immunity?
The vaccines have come to us with the most amazing speed, given that this is a new organism that this time last year very few of us knew very much about at all. So it's an absolute triumph of science that they have come that fast. But vaccines are always best deployed before there is an epidemic or an outbreak. If you look at the MMR vaccine, for example, for children, the whole point of it is to stop there being measles outbreaks through high routine uptake. But in this situation of a new emerging disease, you don't have that luxury. You have to go with the vaccine as fast and as broad as you can as soon as you get it. And that is literally the best you can do. There will always be, unfortunately, people who have been exposed to an infectious disease who are then vaccinated but are not vaccinated in time for the vaccine to have had the required effect to give them immunity before the disease takes hold. That is always going to be the case, and potentially there will be more of those patients in a situation where the disease levels are very high compared to when they are very low. But it is just a biological fact that you can't make a vaccine work faster than its design gives it the capability to do. And typically, antibodies begin to rise at the 7 to 10 day mark, but it's really 14 to 21 days before you see a kind of solid and sustained antibody response. But all vaccines vary, and all human beings vary in terms of the profile of their antibody response at a personal level. Thank you very much.
Thanks very much. Well, just on kind of where we are and how I feel about it, Richard, it's very frustrating, obviously, that we're in a situation where we've got a new strain of the virus surging in the UK now in many parts of the UK, not all of it, but many parts of it, and that's necessitated these tough measures that we're taking, with the knock-on impact, alas, now for schools in the areas most badly affected. And yet I'm also filled with hope by the arrival of this new British-made vaccine. It really is potentially a real cause for optimism around the world, because this Oxford AstraZeneca vaccine, because it can be delivered at room temperature, doesn't have the logistical challenges of of other vaccines which need to be kept refrigerated at -70. I think it can get to places that can't currently be reached, and offers real hope across the world in fighting this pandemic. So I suppose my emotions at the moment are a mixture of frustration plus optimism equals whatever, grim determination or something like that. But we will get through it. I've absolutely no doubt but we've got conflicting currents at the moment. Let's go lastly to Charlie Cooper of Politico.
Hi there, thank you for having me. It's tremendous news, of course, about the Oxford vaccine, and you've introduced stringent new measures today, given the really concerning figures that Professor Van Tam showed us. But given we're now so close to a moment where vaccines change the situation we're in, what is the rationale behind sticking with the tier system rather than going for what many scientists say we should now do, which is go for a full national lockdown until such a time as vaccines, as there are enough vaccines to protect the vulnerable? And a question for Professor Van Tam: what is our latest understanding of whether the new variant will be, whether the vaccine will be as effective against the new variant?
Yeah, well, thanks, Charlie. Look, I'm not going to hide it from you. That obviously was an option that we considered intensively, but on the whole, we thought, given the uncertainties that we still face, the impact of the Tier 4, which is still a bit of an open question, it would be fair to say, and you saw the evidence of how Tier 3 was working on, at least on the old variant. We thought it right to continue with the tiering, particularly since you still have quite a regional differentiation in the way people are experiencing, and given that we went through with that regional approach, that tiered approach throughout the autumn, that seemed to be the fairest way to continue. And but we're going to keep reviewing this both for all parts of the country.
So on the point about the strains and the vaccines, it's a good question. There is, of course, the UK strain, and there is, of course, the South African strain, both of which have been in the news around the world. And both of those viruses, as I understand it, are either in or heading on their way to Porton Down to be assessed by the expert virologists to check that the AstraZeneca vaccine will still be effective. And I understand from my colleagues at Pfizer that they are also conducting very similar experiments to again check on both of those strains in relation to the Pfizer vaccine. That isn't, unfortunately, work that takes 12 hours in the lab. It takes more like 12 to 14 days, because you have to take the virus and grow it up live, and then you have to run it against the sera. So it will be a few more days, potentially a couple of weeks, before our scientists can give us a solid steer on that. But there are two pieces in the background that I think are very reassuring. The first is that there is work now underway by scientific groups around the world looking at a whole range of variant strains, and they are showing that by and large the neutralisation is quite cross-reactive. In other words, the vaccines will cover quite a large range of variants. The other thing is about the vaccines themselves. They don't just produce a very single type of antibody, in other words, one very precise, unique flavour, if you like. They actually create a kind of soup of antibodies of multiple different flavours, and that means that if one fails, there are more behind it that are still going to bind to the virus. And so you would need really very, very substantial mutations indeed to completely outwit these vaccines altogether. So if we were into a situation where there was an effect, I would expect it to be a marginal degradation rather than a kind of, we've lost the lot kind of scenario. I hope that helps and gives you a bit of reassurance, but the proper data is about 2 weeks away, I think.
Thanks, James. Do you have anything to add?
Nothing to add on that, Prime Minister, but maybe if I could just, I started by thanking NHS staff, and perhaps I could finish by, on behalf of the NHS, thanking the public for the response they've all made to social distancing measures this year, because that has really helped the NHS cope. It continues to help the NHS cope, and I'm sure my colleagues throughout the NHS, and indeed should thank all key workers, but across the NHS would want to join me in thanking everybody for complying with the measures and ensuring that we take pressure off the NHS. Thanks very much. Well, what he said, folks, I totally agree with Steve and with JVT, what they've said, particularly about New Year's Eve celebrations tomorrow. Please let's celebrate sensibly, so in a way so as not to spread the disease. Thanks, everybody. Thank you.